want to just indicate that I will not be the one that will be talking here. I will have Gloria Ansa with me. She will be discussing the connection between glutathione and several other medications. So I want to use this opportunity to welcome all of you now here into our age. It's a joy to see everybody. So to start everything, I want to talk about the impact community briefly before we go into the nitty-gritties of the health that we have. Because health is always a precious commodity. But a lot of people joke with their health. And so the essence of this is to help all of us to be conscious of our health and to see the best ways in which we can get better health. Because no matter what you do, no matter what you are doing, your health is what is carrying you across. Your health you have now, that is what is holding, that is what is carrying you. If you lose your somebody part, every business you are doing, every job you are doing, everything you are doing is gone. Sometimes some people pay more attention to the building they are building than their health. They pay more attention to their job than their health. They pay more attention to their families than their own health. And so we want to be able to get back. The impact community is designed for three things. The first thing that the impact community does is to give us personal knowledge. Personal knowledge. This is knowledge that cuts across every sphere of human endeavor. For example, tomorrow at 7 p.m. GMT, we are going to have one of these knowledgeable things. It has to do with parenting 101. Oh, you are going to love this, I'm telling you. You're going to love this parenting 101 tomorrow at 7 p.m. GMT. And it's part of the thing the community, the impact community will do. We give a lot of knowledge. We have doctors, we have lawyers, we have engineers, we have celebrities, we have incredible people across the world, and each person can collectively give that. Tomorrow we have 7 people that are going to give this knowledge on parenting demystified, parenting 101. The next thing the community does is business development. So we help you to be able to create your own personal business and to develop yourself. We teach you, we guide you to be able to do that, to have that personal development by yourself, and to be able to use that personal development to be able to teach yourself and to build your own personal business that you want to do. The third thing is to help all the members of the community to build a wonderful relationship with other people across the world, because we are not living in a vacuum. The world is a global village. So how do you build your relationship and give impact across other parts of the world? Teach you. That is part of the community. And then finally, the vehicle the community has. The community has 2 vehicles. We're going to discuss one today. The first vehicle is the health, a special health. The second vehicle is a project. We're not going to discuss the project today. Today is purely about your health, how you can sustain that at all times. All right. So, ladies and gentlemen, we want to begin very, very quick. So I want to start by telling you something quickly. Personally, the number of people I have seen die physically with my naked eye this year, no, last year and this year is 22 people. 22 people are physically seen dying. And most of these people were joking with their life. But one of them, who was just 23 years, told me that he is stronger than ever before. Nothing will happen. And the world is a very strange place to be. People that toy with their health, they don't know. You know, when a person is sick, there are some sicknesses you will not know that a person has. For example, a person can have cancer for 2 years, nobody is aware, and he is not even aware. A person can have HIV for 10 years, and the person is not aware. Somebody else is not aware. So it is very important we become healthful. Now, one of the things that destroy our health is oxidation. Oxidation is when oxygen comes into contact with a human being. Now, when oxygen comes into contact with anything, that thing will rust. So if you cut an apple into two and oxygen comes into contact with the apple will turn brownish, and that is oxidation. When you cut yam into two, it comes into contact with oxygen. That yam is going to rust. It's going to turn brownish. If you put some cutlass or blade somewhere, after a few days, that will turn into something oxidized. Now, this process of oxidation is because oxygen itself is not good, even though oxygen is good. So this oxidation means that we need something to fight it. And that thing that can fight oxidation is known as antioxidant. Okay. Now, as we speak now, there are 35% of adults who get stressed out. Once a person gets oxidation, the person is going to have problems associated with several health problems. Stress is one of them. Fat and obesity are as a result of oxidation. Diabetes, hypertension, cancer, stroke, dementia, Alzheimer, Parkinson, all of these are as a result of coming into contact with oxygen. Not surprising. The oxygen can destroy a person like that. And so we need to find a way to get around it. But the problem is more serious than we can imagine. But God in His infinite wisdom has put something into the body, an antioxidant. And what this antioxidant does is to fight oxidation. The number one of this internal antioxidant is glutathione. Glutathione is a powerful molecule inside every cell in the body. It strengthens the immune system, it slows down aging process, improves mental, physical, and sexual performance. So when a person has glutathione in abundance in the body, that person is able to fight over 74 diseases. Over 74 diseases can be fought if you have inside you glutathione in abundance. Now, unfortunate thing is that as we age, as we grow older and older and older, over time, the glutathione level begins to drop. It starts from 20. Every year, 1.5% of our molecules, this glutathione, they drop. That's why you see that when a person is growing, his ability to fight diseases gets weaker and weaker and weaker. Now, what causes it to go down? Because of stress. What causes it to go down? Because of too much medication. There are people who have hypertension, they will take amlodipine, consistently for multiple years. And they don't expect that problems will come. But the problems will come because of this. You see, the body is natural. So anything that enters the body must also be what? Natural. That is why our grandparents used to live longer. The obituary rate was quite low because people were dependent on natural things, not artificial things. The food we eat is artificial. The fertilizers we put on the food is artificial. The microwave is artificial. And the microwave is producing radioactive isotopes into the brain, into the body, through the stomach and several things. If you take mobile phone right now and you try to make a call, you spend an hour there, you are producing over 40 notches of radiation into the brain. So the World Health has predicted that by the year 2038, many people would have developed brain tumor. In fact, cancer wasn't a problem much in Africa some years back. But because of use of technology, mobile phone, use of depletion of the ozone layer, use of intelligent cars and intelligent televisions and things, there's a lot of radiation around us. And all of this will deplete the glutathione. The glutathione can protect you and I to be over 100 years. But because we don't have the glutathione in the body, we get these diseases. The diseases you see on your screen are diseases that people get because of low glutathione. Obesity, heavy metal poisoning, things like heart attack, hypertension, diabetes, positive stress test, okay? The pulmonary diseases, asthma, migraine, Alzheimer, Parkinson, autism, bipolar, hepatitis, HIV, infertility, cancer, skin diseases. All of these are because the glutathione level is going down. Infertility, impotency, all these are because the glutathione level is going down. But see, ladies and gentlemen, a lot of people don't know that there is a connection between these diseases and your level of glutathione. So that's why they take a lot of medicines, and the medicines are worse. Okay? When you take the medicine consistently over time, their body sees it as a foreigner over time. So we can take the medicine, but when it becomes so pronounced, a lot of it, then we now begin to have problems. And this has been proven multiple times. So we need something. We need something that can rather raise the glutathione level higher, instead of consistently dependent on drugs. Professor Nagasawa, a professor of several years, his 25 years of research, together with his team of doctors, created a plant. The plant is known as Riboceine. Riboceine has been patented. After 25 years, Riboceine was made in the form of a pill and a powder. That is all herbal. What you do with Riboceine is to take it, swallow it, the capsule, drink it, the sachet. Within a period of 1 month to 9 months, your body's molecular defenses will rise. These diseases I spoke about, over time, your body's glutathione level will rise and will fight these problems. Riboceine is so good that it's been patented and is currently the most advanced glutathione technology around. There are several articles published, peer-reviewed and written on it. The FDA in US, Canada, Australia, Nigeria, several countries have endorsed the use of Riboceine. I've been using Riboceine for 6 years. My mother had diabetes and she's using Riboceine for 6 years. The diabetes was gone 68 days after trying this Riboceine. Ladies and gentlemen, there are several people who have been using the Riboceine and have benefited. Okay? Now, before we go to several people who have used the Riboceine and have benefited, I'm going to let Dr. Gloria Ansa share something little that she knows about the glutathione and some health challenges that she can share with us. Dr. Ansa, are you around, please?
Yes, Doc, I'm around.
I'm sorry, I don't have your slide. So just briefly share with us what things you have seen with glutathione and general health challenges. Any particular health challenge you might talk about.
All right. Thank you all. Thank you, Doc, and thank you all for coming and being with us once again. And like Doc has been saying, that glutathione is one key antioxidant in the body. It's God's own way of helping us to protect ourselves, heal ourselves, and as he mentioned, with the 74 diseases, there are a number of diseases that are associated with the low glutathione level. So there are 2 of them that I just want to briefly talk about. That's hypertension and then HIV. So with hypertension, it's research. There's a lot of research, and once again, you can just go and Google. Like he said, there are so many articles relating glutathione and hypertension, and the fact that when there's low glutathione, it causes to promote hypertension, or it makes it worse, because it means that the reactive oxygen species that cause the oxidative stress, they have a free range to act. So they are acting on the brain, they are acting on the blood vessels, they are acting on the kidneys, and these go a long way to kind of facilitate hypertension. So people are getting hypertension and also having a difficult time controlling it even when they're on medication. And it's one of the reasons why as we age, then gradually our blood pressures gradually go up. And therefore people grow up and then almost all adults are most adults are on one antihypertensive or the other. The other one is, like I said, HIV. What glutathione does is that it stabilizes the cell. the cells, the wall, or the cell wall. But what the virus also does is that it goes into the cell wall, the very cells that give us our immunity. That is where the HIV cells multiply. So when the glutathione level is low, research has shown that it promotes expression of the HIV virus. So they have a free range in multiplying. And then the low glutathione also means that what we call the CD4 is there are some protective cells that we all have that we are able to use to, part of our immune system, and in HIV patients, the level of CD4 count is very important. When it gets lower, the lower it gets, the more ill the person gets. And it's been realized that low glutathione impairs the function of the CD4 cells, which means they may be there, but they are not functioning properly. So what it means is if the glutathione level is low, then it means the person is going to progress faster from HIV infection, which is just the virus being in your system, to a level where your CD4 count goes so low that now you have AIDS, where you have the symptoms. That's where you see people complaining of fever, they are losing weight, this is happening, and things like that. So briefly, these are the things that I wanted to draw our attention to, that there's a lot of research that supports this, that low glutathione is associated with hypertension, and the low glutathione is also associated with bad outcomes when it comes to HIV.
So, let me ask you very briefly. I know you have come into contact with several people who have health challenges like HIV, hypertension, and all of that. What have you generally seen when they take the Riboceine to support them while they are taking their normal medication?
Yes, so particularly with the HIV cases, and sometimes you see people, like I said, because frequently people don't know until it's quite late. So they come very ill. And in some of these situations, when you have spoken to them about the glutathione they have taken and the Riboceine, the results can be amazing. You see them a few months down the line. And in fact, some of them, they have to tell you that, Doc, this is new, because you can make them out, So it supports the immune system to fight back, because the virus is trying to multiply and do a lot of damage, and the body has to be in a position to fight well. So it's like having a strong army to defend your country. If you don't have a strong army, then the enemy will overwhelm your people and then just take over. But the Riboceine supports the individual to build up, and the recovery is better and faster, and then quite remarkable.
Lovely. Thank you so much. Thank you. Okay, I know you've been quite instrumental in helping people's health, and this information is very valuable. We appreciate that. Now, ladies and gentlemen, there are some of us here who have used the Riboceine, have benefited from it, have seen the consequences of the use of the Riboceine. I have seen several people, but I want some of you here to share with us your story that you have, so that we will be able to appreciate some of those stories. So, those of you who are here who have some of your stories to share with us, please kindly just raise your hand so that you can share that with us. It would be very, very appreciated if you are able to do that. Dr. Tettey Doe, are you there?
Yes, I'm here.
Share with us your story.
Thank you very much, Prof. Can you hear me, Prof?
Loud and clear.
Thank you very much. Thank you, Dr. Gloria Ansa, too. Yes, I'm a medical doctor registered and practicing in the UK, and I was introduced to Riboceine by a family member in May 2021, and I started taking it. And the good thing is I not know it was preparing me for something that was to come. And in September of the same year, that was 2021, I had COVID. I had a high temperature and went, and then they checked everything and confirmed that it was COVID. So immediately I went into isolation. And what happened was I had another combination, which was there already, which is, for those who know, sickle cell disease and SC. So these two combinations, I was among those they call the vulnerable groups, because of sickle cell, I was part of those who were in shielding during the pandemic and were restricted, the lockdown in England. So with these two, I tick the boxes of not a very good, what the doctors would say, prognosis. But the good thing was that I was taking Riboceine. And so when I went in, I took my Riboceine with me. And when the doctors came around, they did all the treatment that I took. And when they left the room, then I was in the isolation room. Then I took my Riboceine. And what I noticed during that time was that I didn't need to be in that ventilator that's taking over my lungs breathing. They just gave me some oxygen as a precaution. And by the 48 hours, I didn't need the oxygen because I was just walking around. And in 7 days, I was discharged. I didn't have any crisis for sickle cell. And the good thing is that when I was discharged, during that time, the average date spent in hospital is 21 days, that's 3 weeks. But in 7 days, I was discharged. And when I was discharged, I continued to take my Riboceine, and up to now, I take it. And I'll recommend it to everyone, even to take this Riboceine. It's very good, and it's helped me.
This is good news. This is good news. And I know you were telling me about how they saw, even though you have all of these so-called comorbidities, you were still able to get that thing sorted out by enhancing your glutathione level by taking your Riboceine. So yes. Thank you very much for sharing that with us.
Thank you.
I appreciate that a lot. Let me go to Jennifer Nelson. Jennifer, can you unmute yourself and share with us your story? Jennifer.
Yeah, good evening.
Evening, loud and clear.
Okay. So my name is Jennifer. I'm also a health practitioner. And I was introduced to Riboceine some few months ago. Initially, I was having so much stress and back pain. And when I started taking it, I always woke up feeling very refreshed and always alert. And the back pain too is gone. I don't experience it anymore. And I also realized that because of my weight, I was beginning to have pain in my ankles, which the doctors diagnosed me of arthritis. And when I started taking it, I realized I don't have any pain again, and I now wear my heels as I want to. And
I didn't know about that
one. Yes. And I introduced my mom recently, complained of this bump around her waist, and she said ever since she started taking it, she can't find it again. So yes, myself and my family are so much in love with Riboceine.
And I know you collected your own already this month as well.
Of course, I have.
Incredible. Thank you so much for sharing this with us. We appreciate that a lot. Now let me go to Tettey Doe. Tettey, are you there?
Yeah, hello.
Tettey, briefly tell us your testimony you have for using the Riboceine.
Hello, mass morning, everyone.
We can hear you. Go ahead.
Okay, Dr. Ko, I miss you, by the way.
Thank you.
I've been using the Riboceine for over a year now. Ever since I was little, my whole family, we wear lenses. And when I went for my review recently, the optician told me that my eyesight has improved a lot and that not to wear glasses anymore. So that's my testimony. And my mom also had diabetes and high blood pressure, and she doesn't use any hospital drugs anymore. So that's my testimony, and I'm excited.
Incredible. So what do you do? What have you been doing? What work do you do?
I've got a care agency. I've got a care company.
This is in the UK, right?
Yes, please. Yeah. Okay. And I'm into child care and adult care as well.
Lovely. So based on the work you do, I want to believe that the product you use is helping you and some of the people.
Yes, please. It's helping a lot. So I've got two of my colleagues here. They are also listening to the presentation. Yeah, because I'm not on video, you cannot see them. And so they are also excited about the program for this evening. Yeah, so it's all good, Doctor.
Excellent, excellent. Thank you so much indeed. We appreciate this wonderful gesture you've thrown at us. We appreciate that. Now let me go to Georgina Ehelebre, who is also in the UK. Georgina, are you there? Will you be able to, let me just allow you to unmute yourself. Please click on mute and share with us your passionate testimony.
Hello, good evening, everybody. Max morning.
Good evening.
Yeah, I've been using Riboceine for the past almost 1.5 years, and now it came about was that a friend of mine sent me the link to watch. I didn't. She sent it again. I didn't, and then the third time when she called, I said, "No, let me watch it so that she will stop bothering me." In fact, at that moment, she didn't even know that I was having problem with my knees. So I watched it, and immediately I was convinced that I needed the product. So I got the product in August 2020, and I started using it. In 2 weeks, I could walk, and my grandchildren were all happy with me. Oh, now grandma can walk. She can climb the stairs. And in fact, what happened was that my knee was so painful that when I'm walking, it's like you are driving a car, and then the gear comes out from the third to the first. When it happens like that, I become so static. I can't move. But then when I started with the product, I could now turn in bed. I could walk. I could do everything. Before then, the doctors have started me on a lot of painkillers, and these painkillers were having effects on my liver and my kidneys. And because I'm a health professional as well, I knew that something wasn't right. So when I started it, I found that things have changed with me, and I have still been taking it. I went home in 2021. I found that my husband.
When you say home, what do you mean by home?
Well, I came to Ghana from the UK.
Okay.
Sorry. I thought my husband wasn't well, and he's very difficult with medication. I told him this is just food product, but he wasn't convinced. But I had to persuade him. And even looking at me, he said, "No, now you look very young, very energetic." I said, "Yes, this is what I'm taking, the Riboceine." Anyway, after giving him about 2 weeks to think about it, I started him on it. And up to now, he's also taking it, and he has not stopped. And he's telling people about it. Not only him, I've given it to friends who had hypertension. I've given it to people with asthma, and they have seen that this product is wonderful. Here back in the UK, well, before I came to the UK, I went for my COVID test, and I was told that I had COVID. And in fact, this COVID is a demon. If I had not been on this product before then, I think by now I'll not be around. But because I have been on the product before I went to Ghana, well, it took care of me, and God also put his hand on me. Anyway, coming back to UK, I had a friend also who had the same experience with their knees, like mine. So I introduced her to the product, and she was taking it. Then she went for a review, and the doctors did x-ray on her knee, and they said, "No, something has shifted. What have you done?" I said, "Did you tell them?" She said, "No." I said, "Next time, please tell them that this is it. This is what you use." So in fact, Riboceine is a very good product. And even today, I was telling a colleague about it. And she said, she's so passionate. She said, I should order it for her. So I recommend it to everyone because it is a good product.
Lovely. Thank you so much indeed for sharing this with us. I know you have a lot. If we give you an hour, you will share a lot of these testimonies. Yes. I know you are passionate a lot about this. Yeah. By the way, our beautiful Georgina Ehelebre is over 70 years. Over 70 years with several grandchildren, and yet she's buzzing, she's bothered because she's now much more than that. You can see her passion in her voice. Thank you very much, Georgina, for sharing this with us. Ladies and gentlemen, it is not what people say that matters. What matters is what you do and what you say to yourself. I'm saying this because I'm going to share a very story I've not shared before. There is a professor in the University of Ghana. this professor was having stomach cancer. I didn't know he was having stomach cancer. But when I got it, he knows I'm into this. So one day I saw he was walking badly on the staircase. So I called him and I said, Prof, I think you should try this that I've been telling you. Oh, he says, forget it. Anyway, 2 weeks later, the professor was sad, and he was so sad when I passed by his office. Apparently, his brother has died. His brother died of stomach cancer, and he is having stomach cancer. So when I passed by and I was going, then he called me and said, hey, no, come. I need all your products. Each one of them, I need them. And I said, why? He says, well, my brother had stomach cancer, and like joke, he's dead. And now I can see that. And he's been going to one of the best hospitals in this country. And yet, despite everything, he's just gone. And mine has begun. And so I don't want to make a mistake. So I gave him he bought every one of the products, each one of them, in 4 different products, and bought 2 boxes each of this. Took it. Okay. And I forgot about it. 2 boxes would take 2 months. So I was waiting for him to tell me something in 2 months. It was around 20 days. And he came. I was there when he knocked on my office and he says, well, God bless you. He's gone for the check. They've done multiple scans and they are not seeing anything yet. And he hopes they will not even see anything. He was so happy. And now this was a professor who was against me a lot whenever I recommended this. And now he is sharing it. He's telling people all over. Right? So ladies and gentlemen, it's best not to listen to us, but to try the Riboceine. You got to use the Riboceine yourself. Because when you have used it, that is when you see its potency. And please don't wait to be sick. That's what a lot of people do. They wait to see blood. Okay, when they see blood, then they start running to look for a solution. Don't do that. Prevention is powerful. Prevention is also cheaper than cure. So don't wait, okay, till things escalate before they do it. Okay. I've been using the Riboceine for 6 years. I had insomnia for 13 years. It was gone in 2 days. My mother had diabetes for 16 years. It was gone in 68 days. My father had hypertension for 21 years. Hypertension was gone in 93 days. I have all the records, the medical records of it. So I have reason to tell everyone to use the Riboceine. So for those of you who have not used it, and those of you who have stopped using it, for those of you who are not consistently on it, please use this thing. Even your brain muscles. I've tested this on my master's degree student, MPhil student. The brain muscles are able to think faster when a person is using this Riboceine. The distance between your cerebellum and your cerebellum are enhanced properly when a person is using this Riboceine. What the Riboceine does is not to cure your disease, but it does more than that. What it does is that it raises your molecule, and your molecule will cure your disease. Because your glutathione molecule has the power to cure itself. All it needs are a lot of themselves. Riboceine multiplies the glutathione level. When that happens, incredible things occur in the human body. So please give it to your parents, give it to your mother. Okay? Sometimes we wait for Mother's Day. Don't wait for Mother's Day, Father's Day, or any day. Give it to them consistent, sustain their life. My parents are over 80 years because of this. All their contemporaries are gone. God is in control, but we have to control what God is controlling. Ladies and gentlemen, I want to take this opportunity to thank all of you who have been there. Dr. Gloria Ansa, I want to thank you so much for sharing some of the connections between the Riboceine and the glutathione as it relates to hypertension and HIV. We appreciate that. I want to say a big thank you to Gina Helleberg, Jennifer Nelson, Tettey Doe, Dr. Prosper Tettey Doe, all of you who have been able to share your wonderful experience. Let's go tell the world. We are the better thing. But you see, the world doesn't know. And for those who know, they have not tried it before. There are a lot of people who say, oh, I know it, but they've not really tried it consistently for 3 months. Use this thing. Use this thing. My father is past over 84, and so many people are wondering why this man is still jogging. He's still jogging. When he tells them, even when he tells them it's because of riboceine, many of them don't believe. Okay? So ladies and gentlemen, we need to drum it into the minds of several people before they actually take it. People who are, his children are dying multiple times because they are not believing in the power and the science of riboceine. Don't wait. There's a man I know, the man told me that now he's ready for the riboceine. I said, why? He said, no, please don't ask me a question. I need it. I said, why? You didn't tell me why. He says, because the doctor has told me I need to do surgery. Cardiomyopathy was his problem. He has to do surgery. The surgery is 56,000 cedis. 56,000 cedis. He doesn't have the money. So now he's rushing to come and take the riboceine. Please, riboceine is not an emergency pill. It's not going to solve the problem. If it is surgery, you have to do the surgery. And still take the riboceine anyway to heal faster. You cannot replace the surgery with your product. You can't do that. Because when it is surgery, what it means is that it's reached a critical stage of your life. You need to sort that out. So don't wait till blood starts popping. Don't wait till heart starts, palpitating. Don't wait till joints, aches, and all of that. Once you are 20 years and above, your molecular defenses are destroying. They are going down. They are going down. And so you want to be able to raise your glutathione level. When several things happen, and I've seen several things that happen to people, I have been around a lot of people who were so sick. Some of them had COVID and all of that. And when they are wondering why I'm still strong, I tell them it's because our bodyguarded myself. So please, ladies and gentlemen, let's not toy with our health. That's all we have. If your health, even your leg, your eye, your heart, your lungs, your kidney, your bladder, your liver, your intestine, when any of these organs, I'm telling you, you forget about your car, your house, your enjoyment, your money. You forget about everything. When health starts worrying you, you forget about everything. And that is why we need to pay attention to we are the one who are moving the cars. We are the one who are moving the house, moving the money, moving the people. So we need to take more care of we ourselves than any other thing. Because we are one and we have no replacement. Thank you all very much, and thank you all the audience who have been around this coming to Eric, Ernest, Rita, Ignatius, Johnny Bonzi, Mama Mudu, Mudu Peter Wangi, Salasi Safanu, Daniel, all of you, thank you very much indeed for being on this program. We appreciate your time for coming here. See you tomorrow. Please don't miss tomorrow. It's a very important Parenting 101, the listed time. 7 people are going to discuss how a person can be a parent, a job person, a business person, and at the same time take care of children. What are the parenting tactics that a person needs to have in order to safeguard? If you're a woman, when should you not have sex with your husband? When should the children be educated about self-education? Should a child be educated on self-education when the child is in the womb? How do you control children who are teenagers? How do you balance work, family, parenting, and all of that together? Tomorrow, God willing, we are going to meet here at 7 p.m. GMT, and we are going to dissect all of it. Ladies and gentlemen, thank you very much. Have a wonderful evening.